It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hello everyone, I'm Grace Sells, and welcome back for another edition of Best Docs Network, the show that features some of the best doctors in the Houston area that are really changing people's lives. Up first on our show today, we're going to hear from plastic surgeon, Dr. David Altamira.
I had kind of a bump up here on the bridge, and the end kind of hung down a little bit. It was a little bit big. And I think a couple times in my life, guys had made comments like, oh, our kids would have really big noses.
Well, Holly came in with just the thought that had bothered her for a long time, that her nose just didn't match her face. She's an otherwise very attractive young lady, but she'd always had just a large nose that was out of proportion to the rest of her face.
I mean, overall, Dr. Altamira made the experience so easy and simple. And I think out of all the doctors that I spoke with, he was the one who made me the most at ease with the process. And he said, you know, you can always do more, but let's do something modest for now. And it's just overall really comfortable.
First, we talked to the patient at length. We asked them what they like about their nose and then what they don't like about their nose. There are certain things that, you know, we can change and certain things we don't want to change if they're happy with that. We'll take several photographs from different angles, and then we can project them on the computer screen for the patient, and we can actually morph the images to show the patient what they can possibly look like. And that way we can make sure we're on the same page as far as what the patient wants to look like and what can actually be accomplished in surgery, so that they do have realistic expectations, and we can kind of give them a good idea of what they'll actually will look like after the surgery.
The recovery time was really quick. Dr. Altamira had explained that it would hurt for a little bit. He even gave me painkillers, but I think I took 2 of them. It wasn't as painful nearly as I thought it would be. And I think I had some soreness if I would touch it for maybe a month after, but overall it didn't hurt.
Rhinoplasty is basically changing the shape of the nose. It can be done for a variety of reasons. Usually, a lot of times, just the patient has always felt their nose was too big for their face. They were never happy with their appearance. And so it's basically a great operation that can be used to reshape the person's nose to match their face better.
It was so exciting taking that Band-Aid off for the first time. Like, when you look at yourself in the mirror, you always notice an imperfection that maybe you don't like. And for the first time I looked and thought, oh, my nose is adorable.
A tomato is a superstar in the fruit and veggie categories. Tomatoes contain lycopene, a powerful cancer fighter, and they're rich in vitamin C. The good news is that cooked tomatoes are also nutritious, so use them in pasta, soups, casseroles, and salads.
At Houston Northwest Medical Center, our story began 40 years ago when a group of doctors took the risk of building a hospital in the middle of a cow pasture that was at the northwest side.
attention to detail is phenomenal. From the top all the way down to the bottom. We care at every aspect, whether it's quality, compassion, patient satisfaction, and we don't stop till we make sure that our patients are taken care of.
We have excellent staff, excellent doctors. Our nurses have all gone to do advanced certifications.
The nursing staff here are experienced from 1 year to 40 years in terms of providing women's services care. So we pride ourselves on family-centered care.
In the past 23 years since I've been a physician at Houston Northwest, the hospital has grown with the community. And we continue to perform well with respect to quality, and it's a reflection of not only the physician's care, but also the nursing care in the hospital.
Our facility strives to be a leader in technology, which means that we want to be innovative and we want to provide the best care to our patients. That means the fastest care and getting you the service that you need.
I'm really proud to be a part of Houston Northwest Medical Center, and I know in the future that we'll continue to keep up with the highest, most innovative care.
I'm very excited to see what the future will hold. I know that for this hospital, we're ever evolving and improving.
Where we're headed at Houston Northwest, I think, is as exciting as where we've been. First and foremost, we're going to continue to provide the highest quality of care that we can possibly provide.
At Houston Northwest Medical Center, our story is your story.
At Houston Northwest Medical Center, your story lives on.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market. Betty has a question for Dr. Peter Morgan. Will my venous insufficiency worsen without treatment?
Patients with chronic venous insufficiency that are untreated will always get worse over time. Patients that have a strong genetic predisposition for it will get worse faster than patients that have simple lifestyle issues.
To request an appointment with any of the amazing physicians you see on our show today, head to our website, bestdocsnetwork.com, go to the doctor's profile page, and click on the Request an Appointment tab. You can even request an appointment with our next doctor. It's ear, nose, and throat specialist, Dr. C.T. Nguyen.
Being a cosmetic dentist, it really affected me as I was looking inside the patient's mouths. I wasn't able to breathe, which made me tired and gave me a headache. And it really affected me being able to work on patients.
He wasn't able to breathe out of his nose for the past 20 years. He has this nagging problem of post-nasal drip, congestion, and facial pressure. Dr. Casaberry has tried everything, and he is frustrated with the circle of antibiotics and medication. He consulted me because he wants a permanent solution to his problem.
My first impression of Dr. Nguyen was, wow, amazing. He brought me back, he showed me the problem. He actually diagnosed me having a deviated septum, which means my nose is kind of crooked upside in there. But I really liked how it was very personal, and I didn't feel as though a number. It was really great.
Dr. Casaberry is an appropriate candidate for in-office balloon sinus dilation. Balloon sinus dilation is an FDA-approved procedure that uses a small balloon to open obstructed sinus drainage pathway, similar to the procedure used to unplug arteries that we call angioplasty.
The whole procedure was great. I came there that morning. He did the procedure, and the most thing I felt was just a little pressure inside the nose. Very, very comfortable, and actually I came back to work the next day.
The number one reason that patients come to see me is because they can't breathe through their nose. Most of the time, there's a simple solution for that. It's either a small in-office procedure or a minor surgery that can solve their problem. Medicine has advanced so much that there's always a solution to breathe well and live well.
After the surgery, I was breathing and I heard a lot of noise. So I called Dr. Nguyen. I said, Dr. Nguyen, something's wrong. I said, every time I breathe, I hear noise. He kind of laughed. He said, you know, Derek, you're breathing. You have space to breathe now. That's just the air going in that you never heard before. So I was like, whoa, okay, great. It just really changed my whole life while working on patients. I don't have the clogged nose, and I'm glad I did it.
Switching out that bag of chips with your sandwich to 3 ounces of unsalted pistachios will help raise your HDL cholesterol, which is the good kind. To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you.
Brain tumors can be a very scary thing. I see a lot of patients who think they have a brain tumor. Most of the time they don't. Brain tumors are rare, but they can be very bad. So how do you know if you have a brain tumor? Well, headaches from a brain tumor usually are severe. They usually progressively worsen in severity and in how frequently they occur. And often they occur in the middle of the night. A headache that awakens you in the middle of the night is always a red flag to be checked out. Doesn't mean it's a brain tumor, but it just means it needs to be checked out to be sure. Also, if you have a brain tumor as the cause of your headache, you'll likely have other symptoms. For example, vision changes, double vision, numbness or weakness in one arm or one leg, inability to speak, maybe even a change in your bowel or bladder habits. So if you have any associated symptoms with a headache, or if it's a headache that is new, different, severe, and progressive, then talk to your doctor. Those are danger signals that need to be checked out.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
Well, the issue, of course, is age and gravity. And so I wanted to do the oil therapy because of it's a really nice lift without any incisions or downtime.
Skin tightening is basically taking a device and taking energy such as heat or radiofrequency energy or ultrasound and tightening the skin to a degree where you can actually see effects. The technology these days will actually harness the energy into a delivery system which is not as painful and gives us better results with less downtime.
I knew that the oil therapy was immediate results. I knew that the downtime was 0, and I also knew that it would be a pretty general facelift, and that's what I wanted.
The Altamira procedure takes about an hour. There is no downtime. It's non-invasive, so you can have the procedure done and go back to work. There is no bruising associated with it since it is non-invasive. The effects of the Altamira last about 2 years, and with any type of procedure that you do for tightening, once you have the procedure done, your skin starts aging again.
Have it done. It makes you feel better. It makes your outlook a lot better because you look better, you feel better, and people notice. They don't know what you've done, but they notice that you look great. You look like you have a glow about you. What have you done?
Skin tightening industry these days is really about delivering the best type of energy to get the best type of results. So that's what I like to focus on here at Woodlands Wellness, is that we have researched to find the best procedures for the best results. When we do a procedure, you know that's FDA approved, and it's also going to do the best that we can do to get that result.
You don't have to tell anybody, but other people notice. And it has to do with the brightness in your eyes and just how you feel about yourself, and you want to get up and conquer the world.
For more information and to watch hundreds of videos on the amazing doctors that you see on our show today, head to our website. It's bestdocsnetwork.com. And now it's on to our next best doctor. It's oral surgeon, Dr. Paul Metz.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is so that we can position implants within that bone and avoid the need for sinus grafting and then subsequently lower his overall costs significantly as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and of high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
Debbie presented with severe swelling and large bulging veins in her legs, one leg much worse than the other. She had coexistent, severe, very advanced osteoarthritis in her knees, so she really had some big problems with both of her legs.
Every morning and every night I would measure my ankles and just below my knees. I would have a difference of sometimes as much as 1.75 inches between morning and evening. And when I saw Dr. Morgan, he discussed the options with me. And then, as I said, having double knee replacements, and 3 doctors whom I highly respected all said, get it done before you have your knee replacement because it will do so much in aiding the healing.
Before having her knee surgery, she came in to us to have her veins treated. We did ablations on her legs. Her swelling improved, her varicose veins improved substantially, and her legs felt much better, and she ultimately went on and had knee replacement.
I don't go to bed at night with my legs aching. I don't go to bed at night just sometimes almost in tears if I've had a real active day because my legs were so swollen and ankles were so swollen, and it made a huge difference for me.
The patients that I dreaded seeing previously in my practice, now I enjoy seeing them because I know that almost all of them have been seen and treated by numerous other physicians unsuccessfully, and I know that I can treat them successfully, not only for their wounds, but if they have swelling, pain, bulging veins, heavy, tired legs, all of those things can be successfully treated.
About a month ago, my great niece was over and wanted to ride bikes, and we ended up riding 4 miles that day. I could not have done that previous to not having the vein surgery because it's made a big difference in my level of activity.
Each Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment. On our website, bestdocsnetwork.com, we have a map that can help you find the best doctor that's closest to you. And that could be our next doctor. It's podiatrist, Dr. Gabriel Maislos.
Many presented in my office complaining of a painful bunion deformity. A bunion deformity is that deviation of the great toe, where you see that bump on the side or bump on the top. It has to do with a deviation of the first metatarsal, and basically, you know, it just became really painful for her to walk in her regular shoes.
Yes, because I really had this bunion, I think like probably about a year. And so it had got so bad, I couldn't even wear a shoe. So that's what really made me came in, you know, to have surgery on it.
The next step was for us to take an x-ray and to evaluate her foot and determine what kind of, you know, surgery would be appropriate. So after looking at an intermetatarsal angle, we basically decided that an Austin bunionectomy would be the best procedure. And so that's what we ended up doing.
After I had the surgery, I felt much better. You know, no pain. You know, it just felt better. And I was so happy, you know, to get it done.
I mean, as long as you address the underlying etiology, the cause of it, then you're not going to get a recurrence, and it's wonderful. I mean, you know, people suffer from painful bunions all the time. It can be painful to the point that you can actually develop an ulcer at the side bump, because first it gets red, and the next thing you know, you have a wound. And that can be problematic, because then you can get an infection to the bone.
I mean, it's not sore or nothing. It just feels better. And so he really do a good job, and he makes me feel comfortable. I mean, he's a real good doctor.
Bunion surgery has a bad knock to it. You know, a lot of people are concerned that they've heard from their neighbor, or they know someone at work who's had the surgery, and it's extremely painful. I have some patients that have zero pain from the bunion surgery, but I can keep the area numb for 3 days with a pain pump, which is a device that just gives continuous drip of local anesthetic and keeps it nice and numb, because really, inflammation is the first part of wound healing, and that's in the first 72 hours, so the first 3 days. It's a great relief for patients, really 2 weeks of just not putting weight on it, and you know, we've really come a long way with our surgeries.
If you have asthma, don't let it stop you from playing sports. Swimming, canoeing, fishing, sailing, and walking are all asthma-friendly options.
So John is a wonderful man. He is a father, you know, he works every day, but unfortunately he developed coronary disease at an early age, weakening of the heart because of that. So when he presented to me, the heart function was very poor.
I was a jock, watched my diet, I loved exercise, I ran marathons. I was an NCAA certified basketball and football official. And the people that I work with, they knew me and knew that I was a fairly healthy person. So when they found out I had a heart attack, everyone was floored.
Heart failure means the heart becomes weak, whether it's because of blockages or other things. Viral illnesses can cause heart failure. But for him, it was blockage, not getting enough blood, so the muscle became weak over time.
Before I started seeing her, they wanted me to run through a battery of tests. And when she saw the results of those tests, and I believe she was on maternity leave at the time, she came in and wanted to see me. And it was at that point she actually brought up that somewhere down the road I may actually need a heart transplant.
Over the years, he's been evaluated by the transplant team, and he didn't need a transplant because we had taken great care of him. He's very thankful for that, and I'm thankful for medications and therapies that we were able to give him to keep him really controlled on heart failure.
Dr. V is an amazing person. I owe quite a bit to that woman, and I feel very fortunate that she's my cardiologist.
He did have a device, a shock box put in, so that in the event of an arrhythmia, because the vessels are not working and the muscles not working, so electrical abnormalities can occur, and people can have sudden death from heart failure. So we protected him by putting a shock box. And he has been able to work every day, but he takes his medicines and he's doing great. So that's a great testament to having great doctors paired together and great institutions to take care of patients. And we're very blessed here in Texas because of the Texas Heart Institute.
BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs. Over 90% of diseases are caused or complicated by stress. Some ways to help deal with the stress in your life are exercising, listening to music, writing in a journal, or going for a walk.
I probably wouldn't have done it if my wife had not persisted and said it meant something to her. The discussions about my health and my heart and how the teeth over time could affect it, and that I finally gave in and did it for my wife.
Ed comes in and he wants to get all this work done, and so we basically did a full mouth on him. His teeth were broken down. He had had some dental work a long time ago, but it had basically gotten redecayed and some problems there, so he needed to have a lot of this done.
The thought of being able to come in and get it done, I'll say one sitting, although it's pretty long sitting, was probably the appeal to doing it that way.
So we did the smile lift on Ed, where we opened his bite some, and to get them in a better position, increased the color, made them whiter, brighter, and got them more in alignment to where they weren't hitting all different places. And the results are amazing.
Not like any dentist experience I've ever had. And I had thoughts when I was young about being a dentist, and had a couple good family friends that were dentists, and the experience was nothing like any dentist I had been to.
He's busy, but he was able to come in and we could do this in a couple of visits and get the major things done. These are normal results for us, but you look at it and it's pretty dramatic. But that's what I get to see every day. That's what I love about my work. You get health, get things cleaned up and looking good, but also make it look awesome.
Again, I don't smile too often, but it's amazing how many people stop me, whether it be a TSA agent at the airport or a waitress or someone I'm doing business with that says, boy, how beautiful your smile is. And as a man, I'm reluctant to say, oh, well, yeah, I've had cosmetic dentistry. So I just kind of say thank you, and I said I've been blessed, and I have. When I look in the mirror and smile, yeah, it makes me feel good now.
That's going to wrap up today's edition of Best Docs Network, the show that features some of the best doctors in the Houston area that are really making a difference in people's lives. For more information, head to our website. It's bestdocsnetwork.com. And if you have a question, a comment, or a life-changing story, we would love to hear from you. Send us an email at info@bestdocsnetwork.com. Thank you for watching, and I'll see you next week.